I'm Dr. Rebecca Bowers, and this video is on an exercise I call the fingertip reach, which is to help relax tissues that connect the shoulders and arms to the neck and the upper rib cage. A few things to keep in mind regarding this exercise. It is safe for most people in good health who are able to easily raise both their arms up over their head without difficulty or pain. It should not hurt. If you experience any pain or discomfort while doing this exercise, I recommend that you see a healthcare professional, as this exercise only has you move your arms within what is considered normal range of motion for a healthy person. It works best if during this exercise you take slow, deep breaths to help relax the tissues as you perform the motions that I will be covering next. This exercise can be done seated or standing. If done standing, stand with feet a few inches apart and lift your arms up to shoulder height, having your palms facing down to start out with. Then reach your fingertips away from you. They're not going to move very much, but as you continue to focus on reaching those fingertips away, your mind will send signals telling the tight muscles around your shoulders and neck and rib cage to relax in order that your fingertips might move a little bit farther away from each other. Hold this position anywhere from 10 to 60 seconds, then turn one palm up and continue to reach the fingertips away from you, holding 10 to 60 seconds. Then turn the other palm up and keep reaching those fingertips away. Hold 10 to 60 seconds. Now turn the first palm down and again reach another 10 to 60 seconds. You can then turn both palms up and raise your arms up above your head and reach for the ceiling. Hold for 10 to 60 seconds. Then lower them back down to your sides. Now let's watch in motion, remembering that you should hold each position for 10 to 60 seconds, even though the video is much shorter than that. Sometimes when starting out, a person can't hold the position for very long before their arms end up feeling tired. But with practice, most people get better at holding the position for longer and longer periods of time. As someone gets more comfortable with this, they can also try changing things up in order to relax different tissues. So for example, one might turn their head one way and hold the 10 to 60 seconds with the fingertips reaching away, and then they might turn their head the opposite way. They could also move their hands in different positions, having the palms face maybe forward or even trying to turn them back. But remember that this should be within your normal, comfortable range of motion. You don't want to have any pain, discomfort, or contort your body in an unusual position. I have made this video as a resource for other physicians, body workers, and my patients. While this exercise is safe for most people to do, some people have medical conditions that interfere with their ability to do some stretches or exercises safely. I cannot recommend that you do this exercise unless I have examined you, obtained a thorough medical history, and deemed it appropriate for your individual healthcare needs.